It's extremely busy, so I don't want to delay it too long. So why don't we get started and call the meeting to order at 4:02/1/17/2024. Happy New Year, everyone. We are
Likewise.
getting closer and closer. But before we get to that, let's can I have a motion to accept the notes from November? We did not have a December meeting.
Motion to accept the minutes from the last meeting.
We have a second?
I second it.
Thank you. All in favor, signify by saying aye.
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 All opposed? All right, let's move on. So update from the last meeting, I guess, Dr. Charles, guess you could get in the good news. We are getting very close. So I'll let you tell that part. You're still on? I know that she had a call that she may have had to step away. So we had spoken with the state, and they had given us encouragement to apply. Just put it in context. This is it's been a while. We've had numerous teams. Our understanding was that we had to be 100%, and it still exists, that we have to be 100% ready to provide service. However, they said that we are far enough along. They encouraged us to apply for certification. We had secured space. We had ordered refrigerator. We've done everything. The staff were hired. The staff were trained. So they felt we were far enough along that they didn't want to delay, because obviously there is a period of review and then response where they will have 30 days to review the document and then provide feedback to us. And then we have, another 30 days to respond to them as far as with any corrections needed. So they did encourage us to do that. We are just finishing up some information on the fiscal side to make sure that our reporting is accurate. The state goes on a state fiscal year that runs from July to June. The county runs on a calendar year, so their fiscal year is from January through December. And so we just have to reconcile those numbers. And so we're just reviewing that because we want to make sure that everything is as perfect as it can be before we send it, with the hope that by the end of this week, we'll have submitted the application. So Doctor, did I leave out anything? Dr. Charles?
No, I think you covered everything. So everybody's hired. We have all the stuff now. We have the clinic. This is what they wanted. And so we're ready to send the first application. And when we send it, they have 30 days to give us an answer. If we have something we need to change or any changes, they will send it back, but they have 30 days to review that first application.
So any questions on that before we move on? As I've said in numerous meetings, thank you for your patience. I realize that it's more just, it's not as much of a discussion as we'd like. Until we get the certification, we actually could do the real planning. So I know I apologize every meeting, but I'll continue to apologize because I really appreciate your patience through this sometimes onerous process, at which point, once we make it over the certification process, then that's when the real planning begins. So we're very happy that we've gotten to this point. We have some excellent people that we've hired. I think the last one was our workforce development coordinator.
Yes, she started today, actually.
Okay, excellent.
Yep.
And so and again, she has a PhD in education, or
Yes, and appears in education. I think she teaches also. Yep.
yeah. And so it's so we're doing very well as far as hiring qualified staff. So I'm encouraged that we're going to have the quality of staff to actually do an excellent job and move forward and provide some substantive differences to this community. But we have to get through the process first. And so with construction is continuing in the clinic space. They are ahead of schedule, which is something that you don't necessarily hear of in construction terms. So they continue to, everything's been framed out, the drywall's been put up, I believe the last time I was up there, they had all this sanitary, the pipes and everything were put in. They were just going to be doing the concrete. They may have already done that. The electricals well on it underway. So the thought is that the clinic will be completed in sometime around April. But we do have the temporary clinic that was provided by Moses Taylor at the old Maternal Family Health Center, which is pretty much turnkey. Obviously, some work we did some minor wiring, so our IT could actually bounce the signal off of the tower we have at WNEP, because that was the only line of sight that we had to county property. So that's been completed. So we will be ready to move in fairly quickly there. Now, what'll happen when the clinic's finished is that we'll slowly start transferring operations back to the clinic over here at 315 Franklin. But by leasing the space, it gives us some time to so we're not rushing like we would, right? And you buy a house or something and you're trying to plan that like, okay, we've got to be out of this property, and we don't have that. And it'll also provide some transition time for our patients. So there'll be enough time while we're putting that together to give them information at the Moses Taylor site, or Maternal Family Health site. And so I think that'll be a very smooth transition. So I think that's a positive. The rent they're charging us is the same that they were going to charge us for the other space that was actually in the hospital. So we're very encouraged that they kept that price the same for, quite honestly, a better property with parking. So we're looking forward to that. And I think Dr. Charles, leave out anything?
No, I think did you talk about the board members that we have
Board
to?
members, yes. So we are, several board members' term is expiring. Obviously, it'll continue until such time that we're able to have them appointed by the new commissioners. Since they just started in January, I don't even think they've learned the name of the board members yet. So we will be meeting with them. And if hopefully everyone that is on the board wishes to remain on the board. If not, please let us know. But we would like to, for continuity purposes, just submit everyone's name to the new commissioners for those whose terms expire. And if there's no objection to that, we'd like to proceed. And if there's any discussion based on that, if you want to talk to Dr. Charles or me personally, I can do that as well. But hearing no objection to that, we'll just submit the names that we do have. And we'll move forward. So I think that's all we have right now. There are, Dr. Charles, you want to talk about some things we're looking at with the grant regarding the prison that we're working on securing a grant, and I'll let Dr. Charles take that.
Yes, we're working on a grant for COVID-19, like education and mitigation in the prison system. So we talked with the warden and they were okay with us applying for the grant. We have support letter from the DA's office and a criminal justice board. So everything is going well. We've been in contact with the grant people. They've been sending us a lot of email, what we have to adjust in our application and everything. So the last thing that they ask is for the commissioners to sign on the grant. So for that, we need a letter from the warden. So I heard that is sick actually, so we're gonna try to contact like the deputy warden
Okay.
to have that letter, and then hopefully is a $200,000 grant. So hopefully we can do like a great thing in the prison for for the prisoners over there.
We're hopeful that by putting some procedures and education in place that we can avoid what happened the last time. Because unfortunately, the way pandemics are, obviously, it's not going to be the last time, or even if it's a localized event. The prison, when you say the prison shut down, what does that mean? Well, from your average person, the public, well, it's already shut down. But no, what that meant is no services could go in. Visitation was limited. There was really a cascading event of things that occurred in the prison. So we're hoping that if anything like that happens in the future, or even currently, we'll have some things in place to mitigate the response, because there is a lack of clinical intervention, there was lack of drug intervention, all those things, because obviously, as you can see with the prison, the proximity and things that are somewhat unique to a prison really caused a whole shutdown, and in some ways delayed services that could help transition people out of prison. So we don't want that to happen again.
Yeah. And I think this is a great start, because we can start with that, and then going over there, we'll see exactly their need and what we can do more for that population.
Right. I think that one of the things Doctor and I had discussed is obviously there's a contract with a medical provider in the prison, but what we'd like to do is provide some kind of a conduit, a transition, to ensure that the prisoners are followed up, especially upon reentry into the community. And so that we'd work with the medical provider to come up with a transition plan to ensure that medical care is followed up on. We realize that prisoners and people within poverty, which prisoners are a subset, a huge subset, that may not seek medical treatment until it's too late, or the disease has progressed so far that more invasive procedures are required. So we think that there's an opportunity to work closely with the prison, especially at the reentry level. So any questions regarding that?
On that point, not only the reentry into society, but going into the prison. I always found in private practice, going into the prison, there was little communication, transfer of records, things like that, medication lists, reconciliation, and then leaving the prison back into society. There's very little communication between this health system there and regular private practice physicians and clinics. So anything we can do there is helpful.
So I think the doctor will be picking your brain and others to find out what it is we can do to make a smooth transition, because there are a whole host of it right now. They're trying to do transition for like drug and alcohol treatment and medically assisted treatment, but there really hasn't been the discussion of general physical health. And so I'd like to open that up and, like I said, use your expertise and others just to find out what it is, how we can actually have the prisoners that are reentering on both ends, because you put in something we didn't really consider as the transition in and making it the continuity.
Mhm.
So I think on both ends, both the entry and reentry is something that we can work on, and I think this is a logical place to do it. So thank you for that.
Absolutely.
Anything else?
Just a quick question. Best case scenario for Franklin Avenue, turning the lights on. Approvals go through, construction goes through.
Best case scenario.
Best case scenario.
Now, I hesitate to say this because every time the state yells at me, said, "Don't ever give dates." So this is not a
Not
date
to
per
leave
se. This is not official. If everything goes through and the construction is completed, we're hoping that we'll be delivering, we'll be delivering services before then, hopefully. But as far as delivering service in the completed purpose-built clinic, we're hoping that it'd be like around May or so.
Mhm, mhm.
But that is the unofficial, so for any State Department of Health people that may be listening to this, it's not a hard and fast date, it's just an estimate based on construction.
Absolutely. And you've intimated that before, that rough guidelines.
Right. But I am impressed with how quickly they are doing it. It's something I think I mentioned this the last time. I'm not used to the construction world, especially when it's public projects. That's not something that's frequent. All right. Anything else? I don't think we have anything to vote on because in the past we voted on the regulations. We have all that up and ready. Oh, I do know that as we anticipate the approval, one of the things we will be doing is reaching out. We have to reach out to each municipality and let them know when we're ready for a operation. So that'll be happening as soon as we get the approval. We have to send that out. So we'll keep you posted. I don't think it's going to happen by the next meeting because by the next meeting they'll have just reviewed it and probably made various critiques and want to make any necessary changes.
Yeah.
But I think we're on a pretty solid footing. The main concern, the state, they actually distilled it to the commingling of data with the Right Center, and I think we're able to show them how we are having a really separate IT. So the Right Center IT is part of the construction project in our bi-weekly meetings, and right down to color coding jacks to show that there is a difference, a separate server rack. So they seem very pleased with that. That seemed to be one of the biggest barriers. They don't want us to recreate the areas of Delaware County where they were actually planning on sharing data with an urgent care system, which would obviously be against their regulations. So once again, we thank Delaware for making all the mistakes that we can learn from. So I'm sure Melissa down in Delaware County doesn't look at it that way, but I do thank her frequently. All right. Anything else for before we break? All right, hearing nothing else, do we have a motion to adjourn?
Sounds good.
Okay. All right, second. Annie?
Dr. Shed second.
Dr. Shutt second. Okay, I
Yes,
didn't.
you did.
All right, thank you, everyone. I will see you next month, and we will keep you posted on the progress of the application in between the board meetings as well. Have a
Thank
good
you so much.
Okay,
Super.
have a good
Thank you.
afternoon. Okay, bye-bye.
Thank you. Bye-bye.